Welcome, everybody. You are entering the room 1 on financing for Collaborate and Act. I'll just give it a few minutes as folks come on in and join the link. Okay, let's get started. We have an exciting session for the next 40 minutes or so. As I said, this is the Collaborate and Act room 1 for financing. This topic is on delivering high quality sexual, reproductive, maternal, newborn, child and adolescent services and supplies to women, children and adolescents. I'm joined here with Anuradha Gupta. I see you on the screen. I'll give you a wave there. And Joy Phumaphi. Joy, if you're there, give us a wave. I think you might need to just switch on your video. There she is. So we should have a very exciting conversation for the next 40 minutes with these two women who are going to talk to us specifically around financing solutions to address some of the disastrous socioeconomic consequences of COVID-19 for countries and families across the world. Just some housekeeping for how this session will run. I'm going to hand over to Anuradha in a moment to speak on these topics, and then over to Joy. And then for the later half of the session, we'll have an open discussion. So while all of you will be on mute the entire time, we can see you chatting in your questions. So Etienne has just said, welcome everyone, please use the chat button. So it's at the bottom of your Zoom tab bar. Chat in your questions, comments, what you like, what you're questioning, and we will raise those and have a discussion with Joy and Anuradha. So before I hand over to you, Anuradha, I wanted to just post a poll to the group. So we'll have that flash up on the screen now in relation to our topic. So it reads, as a result of the COVID-19 pandemic, estimates predict that the global economy will contract by 5.2% in 2020. Under this scenario, what is the number of people that will be pushed into extreme poverty? Is it over 30 million, over 40, over 50 million, or over 70 million? Just go ahead and plug in your response to that poll, and we'll get those results shared up in just a moment. We've got about 75% of the votes. If you haven't voted, click now. About 80% of the votes coming in. Just select your response, a couple seconds left. Okay, great. So let's share the results that came in there. So a whopping 70 million will actually be forced into extreme poverty as a result of the COVID-19 pandemic. So with that, I'm going to hand over to Anuradha to talk more about this, and also yes, to kick off the conversation based on that. So actually we'll hand over to Anuradha first. We've got Joy on the screen, but I'll switch over to Anuradha and let's get going. And Anuradha, just switching off.
And you're on mute. Just no.
There we go. We can hear you, Anuradha. Just unclick your bottom left. If it's green, you're good to go. That's a bit muted. Just click it bottom left so that it flashes green. No, still no.
Now I think you can. Can you hear now?
There we go. Good to go.
Yes. Okay. So thank you, Ankita, and sorry for that technology snag. And thank you for setting the stage for this session. COVID-19 is indeed having catastrophic effects. As you just said, the global economy is in a tailspin, and it was a very interesting question that was asked. And really the answer is that the recent estimates predict that over 70 million additional people will be thrust into extreme poverty in 2020 alone. So fiscal space in both high and low income countries is projected to shrink. This would negatively impact both donor and domestic financing. And therefore, there is no better time than now to think creatively about how to secure funding to maintain, restore, and strengthen essential health services for women, children, and adolescents. Less than 4 weeks ago, Gavi, in an unprecedented show of global solidarity, had 42 heads of states come together to raise $8.8 billion in new funding for immunization, exceeding our goal. $1 billion were put through innovative finance, and this was a true testimony to the effectiveness of Gavi's financing model and its success in bringing down vaccine-preventable child deaths by an astounding 70%. I would want to share 4 main learnings from Gavi experience of leveraging creative financing. Firstly, there is enormous value in bringing public and private sector together and crowd-in financing from a diverse range of investors. More than 20% of Gavi funding comes from private foundations and organizations. Gavi's matching fund is another highly creative financing mechanism where every dollar contributed by private sector is matched with another dollar by Gavi. This has encouraged financial contribution from private sector, as well as skills and expertise that are monetized. In addition, our financing pulls in domestic resources from beneficiary countries in a very gradual but highly deliberate manner. Currently, more than 1/3 of vaccine financing is contributed by countries themselves, and our aim is to mobilize another $3.6 billion in co-financing from countries in next 5 years. The second point I would want to make is about how innovative market instruments can help raise resources for a good cause. We all know how difficult it is to secure large funds immediately for any kind of social endeavor. To overcome this problem, Gavi created the International Financing Facility for Immunization, which is popularly called IFIM. What IFIM does is to issue vaccine bonds on the capital market against long-term donor pledges. And people would be surprised that we have succeeded in already raising $6.5 billion through this innovative mechanism. This has given Gavi the ability to front load investments and create impact at an unprecedented pace and scale. Recently, we used IFIM to issue bonds to raise $200 million to help finance research and development of COVID-19 vaccines. Thirdly, it is important to get smart to get the most bang for your buck. In a resource-constrained setting, we have to do more with less. With limited finances, Gavi has been extremely focused in shaping the market to drive down prices of commodities, such as vaccines and cold chain equipment. So we smartly pool demand for 60% of the global birth cohort and back it up with predictable financing and transparent procurement. This has helped us expand the pool of suppliers, create healthy competition, and secure incredibly low vaccine prices. For example, Gavi's price for 1 dose of Rota vaccine is just $2, actually less than $2, compared to about $120 in Switzerland or United States. Gavi also uses advanced market commitment to incentivize manufacturers to produce sustainable, suitable, affordable vaccines for the world's poorest countries. We did it for Ebola and pneumococcal vaccines and are now wanting to do it for COVID-19 vaccines. Lastly, I would say it is laser focus on results that brings in money. Results is what matters most to investors. Gavi has consistently exceeded its goal of expanding access to new life-saving vaccines in poor countries, immunizing more than 1 billion additional children, saving 22 million lives, and generating 250 billion in economic gains in a span of just 25 years. is an investment opportunity that does attract a diverse range of investors, including governments, private sector, and philanthropies. So today, coverage of Hib, Rota, and pneumococcal vaccines is higher in Gavi countries than in the rest of the world, an achievement that was unimaginable in 2000 when Gavi was set up. We are now focused on leaving no one behind with immunization, which means going forward, we would have laser focus on reaching those 10 million zero-dose children who have never received even a single shot of the most basic vaccine, and to us, and to all of us actually, are markers of acute inequities. This is what makes our business case compelling, drawing in 42 heads of states, as I mentioned earlier, including 19 of G20 heads, to commit $8.8 billion in a highly challenged fiscal environment. In summary, I would say results drive investor confidence, and innovative financing mechanisms expand options for a range of diverse investors. We just need to be creative about it. Thank you.
Thank you, Anuradha. I'm going to switch over to Joy now to speak a little bit to the integrated multi-sectoral action approach and some of the solutions you're seeing over there, Joy. If you want to just pop your video back on and your sound, and we can get started.
I'm sorry. Thank you so much. And I want to thank Anuradha for this very concise expose of what Gavi is doing. Indeed, the COVID crisis makes it abundantly clear that you cannot have social and economic activity that drives growth and well-being without protecting good health. The crisis is causing the first major regression into global poverty of this century. There can be no longer any doubt as to the centrality of investing adequately in health. And the numbers that we have just spoke about, speak for themselves. Access to healthcare is an essential service, and it is not a tradable commodity. Yet, because we have made such low investments in health over the past century, and during this one as well, this has led to weak, vulnerable, and unresponsive health systems. And the lack of these critical investments in public health by both national and international investors has shown up the fault lines that we now see with COVID-19 response, with the 70 million going into extreme poverty. But what is even more glaring is what the impact of this is on women, children, and adolescents. They were the furthest left behind before COVID hit. Now with COVID hitting, we are finding that even with financial and social protection mechanisms, which should be there now, are actually totally insufficient. There are some countries, for example, where they are giving out food baskets, and they give out one food basket a month, and a food basket that lasts a family for a week is given once a month. And that is all that countries can afford. And these are countries that are actually spending 3.5% of GDP to support enterprises and to support these food packages. Countries like Bangladesh, Nigeria, Zambia. So the situation is quite dire.
Joy?
Yes?
Would you be able to turn your video on for folks so they can see your lovely face, and we'll spotlight you there.
I turn it on, and I think the somebody there turns it off again. It is on now.
Oh,
yes, sorry about that.
Is
it still on?
Try again.
I don't know what the problem is.
Okay, and just a reminder to folks, chat in your questions as we're discussing, so we can pick those up in the discussion in a few moments. So Joy, your camera is off again if you want to try switching it on. Otherwise,
I keep trying and it switches off. I don't know, maybe it is my and I just apologize. I don't know what to do.
Okay, let's go.
Yeah, but if we continue, I think it is important, first of all, that we did not invest in, we made very low investments in public health. pre-COVID-19, so that we don't have the resilience that the health sector needs, and the health sector is so vulnerable and is not responsive enough. But equally important is evidence that has come to the fore that even as we're investing, we're not making the right choices. For example, choices on evidence and rights-based laws and policies and investments and implementation that determine the results, the impact of health service delivery on women, children, and adolescents. And because of that, I can give you some examples. Some countries in the same income category, but some even with lower per capita spending on health, we're performing much better than others to improve women, children, and adolescent health and rights and ensuring universal health coverage. I'll use one example that we are all familiar with. The US spends more than twice as much on health than either Japan or France. Yet children in the US are more likely to die before their 5th birthday, and women are more than twice as likely to die in childbirth than Japan and France. So and these are the high income countries. Nigeria spends around double per capita on health as Tanzania does, and has similar service coverage. But because of inefficiencies, Nigeria has over double the child mortality as Tanzania. So there are quite a number of these examples. And in addition, it is estimated that 20 to 30% of health expenditure, which is around $2 trillion a year, is wasted due to inefficiencies and corruption. And this is repeating itself during the COVID pandemic. We have seen that inefficiencies and corruption in procurement of PPEs that is not fit for purpose, COVID test kits that are substandard, commodities such as water tanks that are installed or wash basins that have been grossly overpriced by sometimes 200-300% in countries like South Africa. So it is these inefficiencies that we have to address as well. So we have to go to the innovative financing, see how to tap private sector resources better. But it is also equally important that we address the substandard delivery of health services that is making the use of the resources inefficient. Wasted health expenditure severely constrains the budget available for women, children, and adolescent health, and undermines trust both in government and in institutions that are delivering health services. It highlights the need for accountability to ensure budget transparency across the work of government, across development partners, and in civil society. And this is not only limited to countries. We have also, there's also evidence that development assistance that is often substandard because it is aid that is going to unwanted, overpriced, and poor quality technical assistance. And so in some development assistance, this is a large part of the development package. So resources for health need to be pooled. They need to be prepaid and managed efficiently. We need an integrated system that focuses on linking health, water, sanitation, education, environmental protection, social protection, etc., and leverages innovation, technology, and private sector to enhance equity and to enhance quality. And this has to be the new health system that we need to build now, that we need to invest in now, post-2020 and post-COVID, COVID-19.
Thank you. I want to follow up with a couple questions and comments that have come through in regards to what you're talking about. So there are some comments here from Rosanna asking about, with the additional funding received from the replenishment in Gavi, could a part of it be invested in human resources and health? So it's become clear that having well-trained and well-paid healthcare well-paid healthcare has become so important, and how we improve that transparency and accountability with resources coming from the COVID emergency funding. So I think the question really is, are there ways for major global health organizations to actually partner in this and to align on their work to improve these efforts?
Yeah, so it's a lovely question from Rosanna. And I would just say, for example, I said in my remarks, going forward, we are very focused on equity, right? So human resources is something that we understand is extremely important, but we definitely don't want to start to bear the burden of salaries of human resources. And just pointing to building on what Joy just said, that, so I think our investments in human resources are intended to be hugely targeted. For example, if we want to design right incentives, right, or we want to support countries in designing right incentives for human resources for health to actually go to unserved, underserved areas, and advance the goal of equity, then absolutely those are targeted investments that Gavi is looking to make. Another example is training. For example, we know that billions and billions of dollars are traditionally invested in the traditional mode of training. And we also understand the wastage risk there and the risk of misuse. So we are seriously working on new initiatives to radically change the training methodology and explore the use of new digital technologies to sort of make the whole training enterprise much more efficient and useful. So absolutely. So this is an area, but doing things out of box and not just picking up the salaries of human resources that could be very rationally deployed in many countries. The second question that you raise about transparency, and I think Joy also touched on it, is yes, absolutely, there are innovative ways. For example, Gavi acted very swiftly to support countries in immediately responding to pandemic crisis. And we allowed them flexibilities to reprogram our health system strengthening support. And what we saw was that about 50% of reprogramming was for PPE, personal protective equipment. And of course, as Joy said, there is risk of irregularities, or purchases being made at a very high price, et cetera, et cetera. So what we did was we put in place a pre-financing arrangement, which is very unique with UNICEF Supply Division, and put 40 million with UNICEF Supply Division that in turn, contracted with 4 manufacturers to supply high quality PPE, diagnostic kits and gloves to countries. So that is how do we sort of get the biggest bang out of our buck is really a question, and there are ways of doing that. Similarly, on accountability, I would say it's an important focus for us. And this also then applies as much to global actors and the technical assistance that Joy alluded to, that we fund a lot of global actors for, and we have for the last 4 years been completely focused on making sure that the deliverables and expectations on technical assistance are set by the countries themselves. They're not globally set, and then everybody is held to account on delivery on technical assistance. So absolutely, I think a lot more to do, but we are very rapidly moving in that direction.
Thank you. I want to switch to Joy for a question that's come in from Kate on funding timing. So her question is that we've seen very long delays in funds being released for emergency COVID-19 response. How can we all collectively raise our voices to push for changes in how funds are released for emergencies? We have an experience with a donor saying that funds will now not be released until September due to the summer holiday period of July and August. And the virus is certainly not taking a holiday this summer, and funds are needed now.
That is a very important question. In fact, I sit also as the chair of the Independent Accountability Panel, and we are releasing our 2020 report in a few weeks, in about 2 weeks. And there is a strong focus on financing and also on the challenges that we are finding, these type of challenges that we are finding in responding to this crisis. Because of our failure to effectively respond well to this crisis, we weaken the health systems even more. So you are quite right that we need to shout louder, and I think the donors such as and funding agencies such as Gavi, such as the Global Fund, need to accelerate the mechanisms that they use for divestment of funds. I know the Global Fund has done this, and I suspect that Gavi has probably done the same. But we do need, I think, a louder voice. The IEP calls for that, for community engagement, for social media, for the communities themselves to shout louder in order to improve efficiency, effectiveness, and quality. And this is part of the debate. Having the funds released efficiently, on time, and used efficiently and effectively.
Thanks, Joy. Just building on what you spoke about there, a question for Anuradha is, how is Gavi working with national governments to ensure better coordination of funds coming from the big Gs, so government, Gavi, Global Fund, GFF, and the Gates Foundation? This is a common challenge which results in decreased efficiencies.
Exactly. So I think, all of us really collaborated on this COVID-19 response in countries. And our starting point was supporting countries in putting together a response plan, right? A preparedness, they call it a strategic preparedness and response plan. The quality of those plans, of course, sort of are open to comment, but by and large, just having a framework of countries' response was useful for all of us. And then we coordinated and to make sure that there are no duplicative investments, because, for example, Global Fund also started to offer flexibilities. We were offering flexibilities. World Bank was going in with big amounts of money, and it was important for us to stay coordinated on this. So that has happened extremely well on COVID-19 response. But and I think it was easier for us to do it because there was already a lot of legwork that had been happening in terms of just promoting collaboration and coordination among 3Gs, right? And we call it 4Gs actually. It is Gavi, Global Fund, GFF, and the World Bank Group, right? So it's the 4Gs, and we have been trying to understand how we can come together to address big areas of gaps in terms of health systems. For example, result-based financing, or supply chain improvements, or data improvement, which none of us can single-handedly achieve. And so there has been that big push towards coordination. And I think in COVID-19 situation, we saw that giving us some good results. The second question I think that I see here is about country ownership and off budget, on budget, additional allocations, and using innovations for that. So I refer to it in my remarks that I think Gavi was a pioneer in this space, where in 2008 we said, look, we don't want to just go out and give loans to countries, right? But the countries must have greater ownership of immunization agenda. And that is the time when a very innovative policy was put in place, where countries co-finance their vaccines. And it's a very small amount that they begin with, but as their GNI increases, their contributions increase. And that is why we are now seeing that 1/3 of vaccine financing is actually coming from countries themselves. So I think it's a huge innovation that other initiatives can learn from. I know Global Fund is also contemplating something like that, but absolutely. And just a quick comment. I know all of us are talking of massive economic fiscal impact on countries because of COVID-19. And there was a first impulse on the part of several of our stakeholders to say, countries would not be able to co-finance vaccines in this difficult crisis, and therefore we should just waive off co-financing. And we have been reluctant to do that because we don't want to fritter away gains that we have assiduously built during the last about 15 years. And then, we pulled in World Bank and started to explore options of how concessional finance on an interim basis can actually be offered to countries so that, they continue to co-finance, and we don't have to give co-favors. And, DRC, for example, is a compelling example where we just succeeded in making sure that country maintains its budget for essential health services such as immunization and continues to co-finance its vaccines.
Thanks, Anuradha. I want to jump to Joy around issues of corruption. So a question around how we can innovatively improve inherent inefficiencies and stop corruption that is leaching every effort geared toward the improvement of maternal, child, and adolescent health, especially in developing countries. Can you speak to that?
The experience has shown us, I think, globally, that the one strong weapon against corruption is the availability of the information, the openness. So what we need to do is to encourage open and free access to data and to information. And that's not only for the countries, but also for the donors. When Global Fund sends money to, or Gavi, or any of the big Gs send money to a country, this information must be openly available. And the information just mustn't say there's 200 million for malaria in Nigeria. It must say 200 million, which is going to be dispersed A, B, C, D. And this information has to come from the donors as well as from the country. It must not, the country should not carry the responsibility on its own of sharing data. Donors have a responsibility to share data as well. Everybody must share data. This is the biggest deterrent against corruption. I'll stop there. And because if you have access to data, like the how we found out, for example, that water tanks, let's say in South Africa, we've been purchased at 300% more, is because some reporters got the information and they made the information public. But access to information, that particularly on public resource spending, is critical.
Thanks, Joy. Just some final questions while we've got a few more minutes left. I'll throw back to Anuradha. A question from Caroline. Flexibility in funding is critical for an efficient response. What has been Gavi's experience with their 10% allowed reallocation of funding for COVID-19? And has there been good use of this flexibility? And would Gavi consider keeping some element of flexibility in the future?
So great question. And our experience with flexibilities that we immediately offered in the wake of COVID-19 has been very revealing, right? One is that, of course, countries needed to prepare themselves. We know that the spread of this disease has been slower than the rest of the world in Gavi-supported countries. So Africa, the number of cases still low, much lower than the rest of the world. So, and that I think gave time to countries to prepare well. And that is where flexibilities were immensely helpful. What we saw was that, we offered about $200 million in flexibilities because 10% of HSS could be reprogrammed. And what we saw was that a lot of country governments actually decided not to make full use of those flexibilities because they were very focused on immunization as a priority that they wanted to continue with. And they were very aware of the fact that if they stop immunization services, there would be collateral damage and there would be vaccine preventable disease outbreaks, which I thought was extremely sort of refreshing. So we saw overall 60% of what we had offered by way of reprogramming envelope, only 60% of that was utilized and the rest was maintained for critical immunization related activities. When we looked at the breakdown of how they reprogram or support, we found that about half of it was for infection prevention and control, including PPE, and then half of it was for risk communication, working with communities, surveillance, case-based management and things like that. And we also saw some cases where like for example in one proposal, one country wanted some additional money for the defense ministry, right? So there were one or two proposals of that kind. By and large, I think objectives. Future flexibilities, absolutely. And I think what Gavi has been trying to do for the last, I think, a few years is to actually understand the importance of flexibility. You know, we are living in a world which is seeing an increasing number of conflicts, an increasing number of people displaced, you know, uprooted, you know, an increasing number of refugees. And all, if we really want to address the issues of humanitarian crises which are becoming protracted, or these populations that are homeless and are on the move all the time, we have to be extremely flexible. So we have a policy which is called the Fragility Emergency Refugee Policy, which I personally feel is very forward-leaning and which gives us complete flexibility to provide additional health system strengthening support, gives us complete flexibility on programmatic scope. So if we think that in a refugee camp, we need to vaccinate children up to 10 years of age, we can do that, you know, and so a lot of flexibility. So it is important and we would want to maintain that. And I think our board is very much sort of with us on this.
Thanks for that, Anuradha. Bouncing back to you, Joy, and what you were speaking about before in terms of transparency. Another question that's come in from Sarah is, what are some practical ways of ensuring health budget planning, transparency, and pooled resourcing based on the right choices?
Some of the practical ways of doing it, I mean, of ensuring transparency, for example. I just say that, you know, it should really start with the donors themselves. If the donors were publishing in the local press exactly what they are funding in country, why, and what the resources are supposed to be used for, and breaking down the use of the resources and targeting, because usually when resources come, it is clear how much is supposed to go to which district. Then if they make that information available to the local media, openly and transparently, that's very practical. And it's something that civil society groups could push for. And I think the donors as well, because even donor funding is tax money from somebody. And that taxpayer wants to be sure that their resources are being used effectively. And then for the domestic resources, particularly the public sector resources that have been used, usually, but the budget that is approved by Parliament is never actually respected when the funds are actually dispersed. So I think the only practical way is to get parliaments to adopt a system of actually looking at the expenditure as well as and not just at the budget, because the budget session in Parliament is a big issue, but the feedback in terms of how the resources have been used and the efficiency of the resources is left to a subcommittee of Parliament. And I think this should be an open session, which where the public is able to participate and where civil society is able to engage. Because I believe that it's only when we engage civil society and that the openness and transparency will improve.
Okay, thank you very much. We are almost at time, unfortunately, and we've had some great questions come through. I just want to give a nod to some of the questions that have come through so we can close out there. Unfortunately, we don't have time to respond. We did have a question from Sanjana about subnational timely financing and ensuring funds reach the beneficiary is a critical issue, looking for specific examples of success in that regard. Can we recommend what international and local government organizations can do to secure innovative financing based on your experience? So unfortunately, we have to wrap the conversation there, folks, but thank you for your participation. Thank you to Anuradha and to Joy for joining us here today. We will be putting up the link just in a moment to return back to plenary. So you can click that YouTube link. We'll also chat that in so you can click it and return back to the session. Joy, we'll send you back early just to give some headline report outs of what we spoke about. And thank you again for your time and a really great conversation. Thanks, guys.
Thank you.